What's going on, guys? Today's video is like in the title, gastroparesis, dysautonomia or POTS, which is posterior orthostatic tachycardial syndrome, mast cell activation, and hyperglycemia. This isn't a hunting, fishing video or camping video this time. This is something that we've been dealing with as a family for a little over 18 years now, and it has gotten worse. And the only reason I'm doing this video today is I've noticed there's a lot of searches on YouTube for dysautonomia or POTS, posterior orthostatic tachycardial syndrome. I've noticed there's a lot of searches going on right now for mast cell activation. And again, this is something we've been doing for quite a while. My wife, Christy, in 2007 was diagnosed with dysautonomia or POTS. But let me start off by this. I put this in the first of the video because I didn't want you sitting there thinking, because I'm sitting next to a creek, that I'm talking about hunting, fishing, camping. I'm not doing any of that. This is on my hunting club. Perfect place to go. It's quiet and I enjoy the peace. But hunting and fishing does tie into this as part of a stress relief for my wife and myself. So if this doesn't interest you, I'm not doing this video for a ton of likes or anything or views. If I can help one person that's going through this the way that me and my wife is going through it, what it has caused us, what we're able to do, what we're not able to do, what we can eat, what we can't eat, and the dangers of it. And just as a spouse myself, being able to control everything as far as emotions and as far as helping my wife, if I can help one person, video was a success. So the ones that are searching for this, if this can help you, awesome. If you have any questions, ask me and I will get them to my wife. Believe me, she has seen so many doctors over the last years, especially the last 9 months has been very, very critical, been very, very stressful. Let me put it to you that way. So again, if you need this information, thank you for watching. My wife has a family history of gastroparesis, so that was the first thing that come up. No problem. A lot of people has it. Get it under control. Watch what your diet is. Can't eat anything that's a lot of greens. And for the ones that don't know about gastroparesis paralyzes your stomach to where it doesn't digest or break foods down like it should. Certain food, not all foods. Leading up to 2007, my wife wound up getting, I can't remember if it was the flu or pneumonia. It was one of the two. She got real sick. And at that time, I had just went to work for Florida EMS, so I was a full-time EMT. And we went to a show in Pensacola, and she walked to the restroom, and I could see her coming back, and she kept having to stop, catch her breath, stop, catch her breath. So when she got up there, she said, "Something's wrong, I'm trying to pass out." So we left the show, went straight to the ER. Everything was fine, no problems. Fast forwarding, it continued to happen. Getting up out of a chair fast, she'd pass out. Walking a little bit further than what she needed to, she would pass out. And we kept working with doctors trying to figure out what's going on. They checked blood sugar, they checked everything, just trying to get a handle on it. And one of our older doctors that I have seen since I was born, a family doctor, he actually read up on a condition called dysautonomia, posterior orthostatic tachycardial syndrome. A lot of people call it POTS. So he set us up to do what's called a tilt table test. And what it is they strap you to a table, laying flat. They check your blood pressure, check your heart rate, laying flat. The table will lean up, they'll check it again, and the table will stand you straight up and check it again. between laying down and standing up, your blood pressure shouldn't change no more than 15, 20, 25 points. Hers was 50 and 60 points. So when she was sitting down or laying down, went to get up, her blood pressure would just bottom out and she'd pass out. So we started seeing another doctor in Pensacola that actually had POTS himself, and he was on his own medical regimen, medication, so we started seeing him. After about a year, we was very concerned because they had my wife on 15 different medications. And come to find out, some of the medications he's putting her on was contradicting some of the other medications that he had put her on. It was going back and forth, and we were still having a lot of problems with it. It wasn't helping. So we made the decision after about a year or two to change doctors. Let's find somebody else. Let's see what we can find. And guys, I'm tell you something, there ain't a lot of doctors that deals with dysautonomia or POTS that specialize in it. But we got blessed and found a doctor in Birmingham, sent her all the information, and she jumped on it. Yeah, come see me. So our first initial visit in Birmingham, we talked to her, got everything lined up. We had to go back in 2 weeks. Went back in 2 weeks. They did stress tests. They did treadmill. They did all the tests they needed to get a line on what needed to be going on. Looked at the medications that the other doctor had put her on, started taking her off stuff. And now, this was not a fast process. We had to go back and forth to Birmingham. We started out going every 2 weeks to see her. That lasted for several months. Then, okay, things are looking good. Now let's go to once every month. Birmingham, once every month. Now, Birmingham trip for us, from where I live at to that doctor, was a 3.5 hour drive. So we would always kind of schedule our appointments to be kind of midday. That way I could drive her up there and drive back. And I was missing work the whole time, but I wouldn't let her go by herself. Once every month, everything started doing good. We went to once every 3 months. We did that for 4 or 5 months. Everything getting better. Once every 6 months. All right, now we're getting better. Everything's in line. Everything's doing great. Now we're at once every year. And we have been on once every year for about 4 or 5 years. That's how well she has been able to get Christy on the right track with the dysautonomia and POTS. So, fast forward to last year, May of last year. Me and my wife last year was married 24 years. This makes 25 years for us this year. She has always been highly allergic to bee stings. EpiPen stayed around us all the time. We kept them around us, made sure of it. Well, Christy had also got on a Ozempic injection, and my wife went from 240 pounds to 160 pounds. And that had also helped the dysautonomia. Get the weight off, helped her knees, helped everything. She was on the right track with everything. May of 2023, sitting in the house, something stung her on the leg. We got up, we searched. No problems right then. Then her heart rate changed. Then she went short of breath. All the signs of anaphylaxis reaction from a sting bite of some type. So I rushed her to Macmillan in Bruton, where we live at. And when we got there, they treated her, did all the regimen, Benadryl, IV, breathing treatments, and got it back on track. That was the beginning of a nightmare. From that point forward, we was going to the ER. We wound up changing from Macmillan, going to J, because my wife worked for Andrews Rehabilitation Center as office coordinator in J, Florida, right there at the hospital. So we decided to start going to J. That one trip to this date, March 2024, we have been to the ER 30 times for anaphylaxis. Several times I've been able to treat it at home and get her reversed from it. Food sent her into anaphylaxis. Cinnamon was a big one. Either touching it or smelling it sent her into anaphylaxis. A Clorox from work sent her in anaphylaxis. We could not get a handle on what was going on. We started seeing our allergist in Pensacola. He started doing testing, started checking everything, and just trying to research it. Couldn't figure it out. Said, okay, let's send her to stomach doctor, let him go in, do a scope, take a sample lining of the inside lining of the stomach. There has always been a little nodule in her stomach that they have been keeping close check on for years because of her family history with stomach cancer. It's never changed. No cancer in it. While he was in there, he went ahead and took a sample of it and a sample of the lining, and the little nodule come back full of T cells. T cells is what your body produces with the histamine. So come to find out what it was is her body is producing too much histamine, which means any little food, any smell, any touch can send her into anaphylaxis reaction. Guys, I'm talking about me driving 100 miles an hour to get her to the ER because her breathing has changed, labored breathing. She itching all over. We wind up having to do Pepsid, over-the-counter Pepsid, twice a day. She would keep Benadryl with her 24/7, a steroid with her 24/7, EpiPen 24/7, and a breathing treatment, either a puffer or the canister to where I can actually mix the breathing treatment in with her 24/7. That is her lifeline. We call it her survival bag, is what we call it. By the time we get to the ER and walk in the ER doors, we had been there so many times that registration would say, go ahead, go get in your bed. We'd walk through, they said, yep, get in this one, Christy. We'll be there in just a minute with all your medicines. And again, she takes Pepsid daily. She has Benadryl on her. When a reaction comes up, she takes the Benadryl. I try not to give her Epi if I can help it, because just too many Epi isn't good for you. And I'll get back to that in just a second. We find out something different about the Epi. And then they give her a steroid shot, breathing treatment, and the coughing was so bad that they had to start giving her cough medicine with codeine in it as part of the regimen also. But what we did not know was because of her dysautonomia deals with high blood pressure and low blood pressure. Very rare with dysautonomia. Believe me, my wife is at 1 in a billion. So she was on a beta blocker for her blood pressure. What we did not know, and we found out months later after all this was going on, about 7 months, matter of fact, that a beta blocker for your blood pressure will block EpiPens and steroids where they are not being used to the full effect. So she had to come off of the beta blocker and go to a calcium blocker, which has got her blood pressure screwed up yet again because of dysautonomia. There was times being in the ER because of the anaphylaxis that her blood pressure was 260 over 120. It was high. and because of the coughing and everything. So during all this, we're having to change blood pressure medicines. We're having to get a different regimen going. We're still searching. So our allergist finally said, okay, I believe this is Mast T cell syndrome, or mast cell activation syndrome. Now we need to go see a pathologist. We need blood work done. Let's make sure this is not some type of a very rare cancer. Me and my wife both lost it then, because we dealing with enough. We didn't need to deal with this. No type of cancers, none of this. She broke down, and dude, when my wife breaks down, it's hard for me not to break down. So went through with that doctor, did the blood work, did everything they wanted to do. He wound up contacting us and saying, I'm 99.1% positive there's no cancer. The only way to know 100% is we have to do a bone marrow sample. Guys, bone marrow samples hurt. They're painful. So this was in December, right before Christmas, and we said, no, we're not doing that right now, not with the holidays, not with everything going on. Let's hold off. You're 99% okay. Let's start working something else. So guys, it's been a roller coaster the last 9 months. We're still dealing with the mass, but Christy just went and seen her dysautonomia doctor yesterday, and her blood pressure is still out of whack. Her stress level is out of the roof, dealing with everything we got going on. So they changed her medicine up yet again to kind of help her with that. And not only are we dealing with gastroparesis, dysautonomia, mast cell, now hyperglycemia. Her sugar has been staying up in the 300s. She is sleepy all the time. She's fatigued all the time. She just don't have no get up and go in her whatsoever. So over the last few weeks, we've been dealing with the hyperglycemia, trying to get it down. She went and seen our family doctor, and they're all convinced that because of the steroids that we're on, one shot of steroid will stay in your system 4 to 5 months. At one time, she was getting steroids once to twice a week injection because of the mast cell. So all that's playing effect. Because of the steroids, it has caused the hyperglycemia, and she's put her weight back on. She had to come off of the Ozempic shot. So if this video can help anybody dealing with any of this, if this video can help the spouse of someone dealing with this, my wife has been scared to death that I'm going to be mad at her, that I'm not going to want to go to the hospital anymore, that I'm not going to want to stick around. I won't leave till she does, and I'm going to be with her till the end of this, 100%. When I said, when we got married, our vows was in sickness and in health. I took that 100%. For the spouses that is out there, that whether your husband's got it, your wife's got it, your boyfriend, your girlfriend, anybody that's got this and dealing with it, guys, this is life changing. It's not life ending. You can continue to do stuff that you want to do. Just be sure you have everything with you that you need. For us, this is us only. We carry Pepsid, Benadryl, Epi, breathing treatment, and cough medicine with us everywhere we go. Everywhere. She can be driving and all of a sudden go by a field, and this has happened 3 times recently. The farmer has sprayed something in the field. Just that chemical has sent her into anaphylaxis, severe coughing, itching, difficulty breathing, all the above with the mast cell. So, and the people that is dealing with it, I'm praying for you. My wife, when she went and seen the doctor yesterday with the dysautonomia, the doctor told us that I deal with people with mast cell due to either having gastroparesis and dysautonomia, which is a big thing. There's a lot more people with that than you really think. But she told Christy that I've got 5 or 6 patients with what you got going on similar. She said, I've got 5 or 6 patients that deals with a mast cell. It kind of goes hand in hand with the dysautonomia. If you get dysautonomia and gastro, you're going to have a mast cell. Or let me rephrase that. If you get dysautonomia or if you have gastro, usually mast cell shows up. But she says, I have one patient that I have ever seen in my 40 years of practice that has all 3. And if you have all 3, you're called a trifecta. 1 in a billion gets this. You don't see very many people. Christy is the one out of 40 years of doing this for this doctor of dysautonomia. Christy is the first one to be a trifecta. So we go later in March. There is a doctor north of Birmingham. See, like Birmingham's got all the good doctors, all the specialists. So we've got to go north of Birmingham to see a specialist that actually teaches mast cell in colleges. He is our next stop to see what we can do to help her. Now, I said in the beginning of the video, this wasn't about hunting, wasn't about fishing, camping. But those 3 things tie into what we've got going on. Christy cannot eat anything really from the store. Hamburger meat, steak, pork. She can eat chicken. Had no issues with chicken. Had no issues with fish. So we hunt a lot. I make hamburger meat out of our deer meat. That way we can do spaghetti, we can do tacos, we can do hamburgers, anything that takes hamburger meat we can do because I do it with a deer. We fish because she loves catfish, she loves bass and crappie. They're 100% clean meats, no additives added to it. So we don't have to worry about, like with beef, the steroids, additives that's been put in it. Chicken, like I said, so far we haven't had no issues. Everything for her has to be grilled. She can eat spaghetti and she can eat the tacos. But we have to watch what seasonings we put into it. Tony Sashers, a lot of stuff that she loves, the Slappy Mama seasonings, all that stuff she cannot have anymore. We have found a season. I'll have to get with her and see what it was. Garlic doesn't bother her. Salt and pepper doesn't. She actually uses sea salt. She don't use iodine salt. Nothing whatsoever can be fried. Fried deer meat, fried chicken, fried turkey breast, anything fried that is in a flour, she cannot have. Lemons, lime, she cannot have. Stay away from cinnamon. 100%, that sends her into a severe anaphylaxis coughing reaction. So, but this video was basically, like I said, I did a search on YouTube to see what would come up. There's a lot of searches for dysautonomia, mast cell activation. So this is our first-hand experience in it. It has changed us 100% because we have to be very careful on where we go eat at, make sure nothing is going to harm her. And like I said, we have that bag, 24-hour bag. My truck has a 120 volt plug in it. So we take my truck a lot of places we go to Birmingham, because if we're driving and she goes into a reaction, I can pull over, I can plug everything up and give it to her right there in the truck seat while we're still driving. So, and guys, I apologize. This ain't my normal video. This ain't normally something that I do. But it is, like I said, it's been very, very life-changing for us. And I'm sorry, I'm going through my notes just to look to see, make sure I covered everything I want to talk about. But thank you guys for watching. And again, if there's any questions that you have on any gastroparesis, dysautonomia, POTS, mast cell activation, hyperglycemia, ask them. Oh, and with the hyperglycemia, we changed her and put her on some medication to help lower her blood sugar. It has lowered her blood sugar. It's staying around 140s to 180s instead of 300s, high 280s, 300s. But the medication has now given her migraines. So we've got to change that up so that she can not have the headaches and still be able to work the sugar down. So guys, again, thank y'all for watching. I hope this was informative. Like I said, this video, if I can help one person, just one, that's all I care. If I can help one person, I'm thrilled over the video. I hope it helps. I hope it helps a lot more. I'm not a doctor. I'm no longer in the medical field. I'm not going to give you diagnosis on what to do. But what I can tell you is what has helped us deal with it. And don't let it ruin your life. Don't stay inside. Get out. That's another thing also, when I said outside. Christy now has to wear a hat with a brim all the way around it and long sleeve shirts. Because either it's the medication she's on or part of the mast cell with the mast T's. She gets burnt very, very easily now. She gets hives at times with the sun. So any place that we go, it's going to be like this, where we can get in the shade, where we can camp, where we can fish. So thank you guys. Thank you for watching. Thank you for taking the time to watch. And I hope this helps you. Y'all have a great day and God bless you.